Well, new tonight, U.S. health leaders are recommending all Americans who receive either the Pfizer or Moderna vaccines get a third dose. And President Joe Biden says that booster will be available soon. Reporter Mary Klingler breaks down what you should know before its arrival. Mary?
Well, Beth, right now, those vaccine boosters are available to 3% of the population, and that's people who are immune compromised. But they appear to be within close reach for the rest of us, too. Here's a look at who qualifies and the proposed timeline. Here's the deal. If the FDA authorizes the boosters, doses could begin the week of September 20th. You would be able to get the shot 8 months after your second dose. So say you got your second dose today. You wouldn't be recommended to get the booster until April of next year. That's 8 months later.
Unless they're immunosuppressed, so there is no need to get a booster until your antibodies start to decline.
There is a catch, though. This is only recommended for the two-shot Moderna and Pfizer vaccines.
The side effect profiles are still very similar. We just don't have as much information around mixing vaccines as we do around boosters with the same vaccine.
So what about the people who got the Johnson & Johnson vaccine? Well, Dr. Smith with American Medical Response says fewer people have gotten those shots, so there's less information out there.
If you can't get another dose of the Johnson & Johnson, then to go ahead and get the Pfizer or Moderna. But your first choice is to get an additional dose of whichever vaccine you had previously.
And Dr. Smith says it's his understanding you don't have to bring any documentation to receive this booster shot.
But it would be helpful for you to bring that card so it can be added if people are asking in the future if you had a booster.
Well, the booster rollout is expected to mirror the way vaccines were first administered in Beth. That means with healthcare workers, nursing home residents, and people over 65 in line first.
All right, Mary Klingler with an update on those boosters. We've had several viewers email us wanting to know more, so thank you. We appreciate the update.